How does racial trauma impact racial identity? Racial trauma refers to the emotional and psychological harm caused by experiences of racism and discrimination. This trauma can deeply affect how individuals see themselves and their racial identity. Racial identity is the sense of belonging to a racial group and the meaning attached to that membership. The relationship between racial trauma and racial identity is complex and multifaceted. One significant impact of racial trauma is the internalization of negative beliefs. When individuals face racism, they may internalize societal messages that suggest inferiority or negative stereotypes about their racial group. This internalization can lead to a decline in self-esteem and create conflicts within one's racial identity. People may feel shame or confusion about their racial background, which can worsen psychological distress and lead to symptoms similar to those seen in post-traumatic stress disorder. Racial trauma is often not a single event but a chronic experience. It is embedded in ongoing societal racism and historical oppression. This persistent nature means that racial identity is continuously shaped by external narratives and internal coping processes. Strengthening one's racial identity can be a powerful way to build resilience against these negative experiences. A strong racial identity can help individuals resist harmful narratives and foster a positive self-image. Research shows that having a strong and positive racial identity can protect against the adverse psychological effects of racial trauma. Individuals who take pride in their racial identity and have a well-integrated sense of self tend to experience fewer symptoms of post-traumatic stress disorder and better overall mental health. This protective effect occurs because a secure racial identity can reduce emotional avoidance and promote healthier coping strategies. The impact of racial trauma on racial identity also varies based on how individuals internalize their racial identity. Those who have a deep acceptance of their racial identity may be less affected by racial trauma. In contrast, individuals with a weaker sense of identity may be more vulnerable to the negative effects of racial trauma on their mental health. Emotional avoidance is another factor to consider. A conflicted racial identity can lead to greater emotional avoidance, where individuals suppress or avoid feelings related to their trauma. This avoidance can worsen the severity of post-traumatic stress disorder symptoms. Therefore, the strength of one's racial identity can influence not only the experience of trauma but also how symptoms are managed. Racial identity is also shaped by social and cultural contexts. It is not just an individual experience but is influenced by family, community, and historical narratives. Collective experiences of racial trauma, such as intergenerational trauma or systemic racism, play a significant role in personal racial identity development. Engaging with these collective narratives can provide meaning and a framework for healing. Understanding the connection between racial trauma and racial identity is crucial for effective mental health care, especially for racially marginalized populations. Clinicians should consider the strength of racial identity and any conflicts when assessing trauma. Interventions that promote racial pride and cultural connectedness can enhance resilience and reduce symptoms related to racial trauma. In summary, racial trauma profoundly impacts racial identity by challenging self-concept and fostering emotional avoidance. However, a strong and positive racial identity can serve as a protective factor, promoting resilience and mitigating the psychological harms of racial trauma. Addressing racial identity in trauma care is essential for supporting the mental health of those affected by racial trauma.